are now 3 COVID vaccines available to the public. All are effective at fighting the virus, but due to centuries of medical abuse, Black Americans are less likely to trust it. I also don't trust it, but only because it didn't catch me during a trust fall. I asked Mike Brown to find out how the medical community can regain the trust of Black Americans and get everyone vaccinated.
It's March, again. But a year into this pandemic, we finally have something to show for it other than mask acting. I'm talking about the 3 new vaccines available. And while they're the first exciting thing to happen in a literal year, a new study suggests that African Americans are 40% more likely to not pursue vaccination, even though they're dying from COVID at a disproportionately high rate. But surveys have historically been wrong.
Name something that follows the word pork.
You pine.
So I decided to talk to some Black people to double check. Would you take the vaccine?
No. If I'm not gonna die, I'm gonna let it fly. You dig?
What if Barack Obama came out and said, hey, took the vaccine, it's great. Would you take it then?
I don't care if my mother said it, you know what I mean? It's more about my system, my thoughts.
What if it was a really funny meme? Would you trust the vaccine? What if it was Full Frontal host Samantha B?
Who is that?
I knew she should have changed her name to Jimmy B. Anyway, we did speak to a lot of people who were ready to take the vaccine, but they all knew someone who wasn't. Do you have any friends who need convincing about the vaccinations?
Yeah, my husband.
Really? Oh, that's a fun household.
Yeah.
My grandmother said that the vaccine was made by white people to kill Black people because they're living too long.
Oh, she is very smart. She is on to something. Were you always ready to take the vaccine?
Absolutely not. Before I'm a healthcare provider, I'm a Black woman, and I have, that baseline general distrust with a lot of the systems in this country. So
why?
You know why, wink, wink.
Oh, I know why. In America, you're old enough to know why too. Doctors have historically exploited Black people in the name of science. From cruel experimentations on enslaved people to the more recent Tuskegee study where Black men were denied the cure to syphilis to, just see what happens. Black people have been in America long enough to be wary of all white things, including white coats. But a group of people is trying to soften the vaccine stigma and is bringing that information into the cornerstone of the Black community. No, not Tyler Perry Studios, the Barbershop. I sat down with Dr. Thomas, barbers, and stylists to discuss how they're getting Black people the care they need through a program called HAIR. Don't worry, we all got tested and ditched the masks.
We started HAIR, Health Advocates, in Reach and Research, because Black people are dying before their time. Living sicker, dying younger from these chronic diseases. Hypertension, cardiovascular disease, diabetes, cancer. That was all before COVID. So we've been in these shops for 10 years, bringing what we believe is the answer to the table. We bring the health professionals into the shop. So our barbers and stylists make their shops safe spaces for that conversation to happen.
Another thing that's affecting a lot of people in the Black community, like myself, is a lack of a hairline. Do you know anything that can help me out?
Absolutely.
Damn, I haven't seen my hairline since I was 14. But Dr. T's hair program brings health professionals to the shop because Black people inherently trust their barbers and stylists. Yes, even more than this illustrious group of people. Why do some of us trust our barbers more than our physicians?
I think that most of our clients trust us because they build a relationship with us. I know most of my clients, they come like every week, every 2 weeks. So a lot of times when they're in my chair, we're always talking about personal things.
We're marriage counselors, health advocates,
Nutritionists,
stylists. We got a whole lot of hats in the closet to wear. And those hats, we can put them on easily because of the relationships that we have with them. I got customers where I've cut the father, he had a son, he's grown up now, cut his son. So it's generations like that I could tell you, man, you need to stop playing. You need to get that shot, stop playing with it, man.
The Black Barbershop is a community gathering place, man. It is our sacred space.
It's the Black Man's Country Club.
Yeah, it is.
You can get a drink, get some advice.
And come out looking good.
You can't do that anyway. You can't just go somewhere, get a little drink, get cut up, leave, feel better, look better. No, usually you get a drink, you leave, you look a little worse. Right. It's never. But the shop isn't just the coolest club you've never been invited to. It's also a place where these barbers have to combat the racism that permeates the medical system both historically and currently. And sometimes that's even harder than accomplishing a perfect fade.
3 months ago, people were saying, hell no, I ain't taking no shot. But 2 weeks ago, the hell no people were saying maybe. And the maybe people are now saying, where do I sign up? And now the people who have signed up are saying, nobody's calling me back. The system once again slams the door on them. And when they open up some of these vaccination clinics in black communities in an effort to come closer to us, guess what? Folk we ain't never seen come across the border, white folk, to get in line ahead of us.
Yeah.
And black folk watching that, and it becomes obvious. The default is, well, maybe black lives don't matter.
Yeah.
We got to fight that. So the real take-home message about Tuskegee is that black people should be prioritized to get the vaccine. That's the real lesson. Yeah. Because in the Tuskegee study, they were denied.
So once you get your clients to take the vaccine, like hair's work is done, you did it.
We started with chronic disease,
We cover everything.
and we gonna stay.
Dr. T and the hair program shouldn't be the only ones healing the divide between the black community and the medical community. Real steps toward equality can begin by the government ensuring that black people are prioritized for vaccinations. And then we could get to the real work of making barbers cabinet-level positions.
Aw, thanks for watching. If you'd like to hear more from Full Frontal, hit subscribe and visit our page for more videos. Or if you'd like to be radicalized, leave YouTube on autoplay.